Namaste, this is from DFR Mysore.
Yes, namaste. Namaste.
Okay. Is it audible?
Madam, can you hear us?
Yes, yes, we can hear you. Hello, sir. How are you, sir?
Hello.
Hello, sir.
Yeah. Okay.
Yes, sir. We can hear you. We can see.
Yeah. Okay.
Sir, we'll just wait 10 more minutes to join the dean and other faculty members, sir. మీరు లైట్ కి ఆపోజిట్ లో ఏమైనా ఉన్నారా సార్? డార్క్ గా ఉంది. ఆనంద్ సార్.
హలో
సార్
చెప్పండి.
లైట్ కి ఏమైనా ఆపోజిట్ లో ఉన్నారా? అంటే
నో ప్రాబ్లం, డోంట్ వరీ బ్లాక్ అండ్ వైట్, నో ప్రాబ్లం.
ఓకే, ఫైన్, దట్స్ ఫైన్. It's okay, sir.
Okay, no problem, no issue.
కొంచెం ఫోన్ చేయండి.
Principal subject. మంచి ఫోటో మబ్బు వస్తుంది. సార్ లాగౌట్ అయిపోయింది. సార్ లాగౌట్ అయిపోయింది. ఎక్స్టర్నల్స్ సరే కదా చేస్తారు. మంచిగా కదా మంచిగా ఎప్పుడు అదే వస్తుంది కదా వస్తుంది వినిపిస్తుంది. స్క్రీన్ షాట్ తీసుకొని షేర్ చేయాలి. హలో అందరూ అక్కడ ఉన్నప్పుడు కెమెరాలు ఓపెన్ చేసినప్పుడు స్క్రీన్ షాట్ చేయాలి. ఓకే మెయిన్ గా మనకి కృష్ణారెడ్డి సార్ ఒకటి వర్డ్ డాక్యుమెంట్ లో పేస్ట్ చేసి స్క్రీన్ షాట్ అన్ని పేస్ట్ చేసి మార్నింగ్ జాస్తి ఇచ్చాను మళ్ళీ బయట ఎక్కడంటే వచ్చేసాను. జాయిన్ అవుతున్నారు అయిపోయిన ఎక్స్ట్రా జాయినింగ్ అని రాశారు అయిపోయిన ఓకే. తీసుకురా మనం అందరు జాయిన్ అవ్వలేదా కింద నమ్మకం స్క్రీన్ షాట్స్ దీంట్లో స్క్రీన్ షాట్ కొట్టి ఇక్కడ వర్డ్ లో పేస్ట్ చేసి మీరు
ఫోటో ఏదంటే
మీరు కూడా అక్కడ అది అక్కడ మనకి అదే స్టూడెంట్స్ మ్యాథ్ కోసం కావాలి.
మొన్న తీసింది మేడం జరిగింది ప్రజెంటేషన్ ఇప్పుడు సార్ వచ్చిన ఎంతమంది మళ్ళీ జరిగింది మేడం మంచి
అట్లా చేయవా ఎప్పుడు కావాలి
మనసరిగా మంచి మనసరి లాగా ఉంటాం కాబట్టి ఇంకా కొట్టుకుంటే ఒక
సార్ ఇచ్చారా సార్ చాలా మేడం చాలా పద్మా మేడం ఇచ్చినాను మేడం. సౌండ్ వచ్చినారు మేడం సార్. ఎస్
Can we start?
Yes, sir, we can start. Yes.
Okay.
So, with the permission of Krishna Reddy sir and Anand sir, can I start the program, sir?
Yes, madam. Please, you can go, Dr. Dakshani, madam.
Namaste, madam. Namaste, sir.
Namaste, Andy.
Krishna Reddy sir, namaste.
Namaste, Andy. How are you?
Fine, sir. Fine, sir.
Please, Amma. Kanima Dakshani.
Yes, sir. Very good morning, respected Dean of Sciences, Professor K. Krishna Reddy sir, and the Principal YVU, External Expert Member Dr. T. Anand, Scientist F from Defense Food Research Laboratory, Mysore, all the faculty members, research scholars, and students. It's my great pleasure to welcome you all to witness the open viva voce examination of Miss L. Vajravati under my supervision, the Department of Genetics and Genomics. So, she joined the PhD program in our department under my guidance in the year 2016. She is dedicated and hardworking researcher in my laboratory. She published some of her thesis work in a high impact factor journal, the Antibiotics, which has the impact factor about 2.63. She also published a review article. Few more manuscripts are under progress for publication. Now, with the permission of the dean and the external examiner, I would like to invite Ms. L. Vajravati to present her PhD thesis work entitled Synthesis and Characterization of Silver Nanoparticles from Catharanthus roseus and Azadirachata indica, evaluating their antibacterial, anti-cancer, and wound healing properties. Thank you, sir.
Thank you. Good morning to Dean School of Life Sciences and Principal Vimna University, Dr. K. Krishna Reddy sir, and the external expert member, Dr. T. Anand sir, from Defense Food Research Laboratory, Mysore, and all the faculty members, research scholars, and students. Today I am presenting my Lakim Vajravati, research scholar in the Department of Genetics and Genomics. Today I am presenting PhD Viva voice presentation entitled Synthesis and Characterization of Silver Nanoparticles from Catharanthus roseus and Azadirachata indica, evaluating their antibacterial, anti-cancer, and wound healing properties under the supervision of Dr. L. Dakshayani Madam, Associate Professor, Department of Genetics and Genomics. Before going to introduce my thesis work, I am giving a brief introduction about nanotechnology. Nanotechnology is the science deals with synthesis, design, characterization, and application of materials in at least one dimension on the nanoscale. The word nano originally comes from the Greek word nanos, meaning dwarf. Today, the scientific usage, it is not a word, but it is a prefix, and it means really very small, and precisely it means nearly 1 billionth time. These are the nanoparticles applications in biology. Nanobiotechnology is based on the biological biomimetics or biological inspired molecules, and nanobiotechnological devices are used to monitor or control biological process. Among many types of nanomaterials, metal nanoparticles and quantum dots are receiving significant attention in scientific field. Generally, nanoparticle size ranges between the 1 nanometer to 100 nanometer. Main parameters for these nanoparticles are shape, size, and surface charge. These properties mainly influence the cellular uptake and transport particles in the fluid system. These are the naturally occurring nanostructures. The hair, bacterium cell, protein, individual atom, tissue, human cell, and virus, and DNA. These are several examples. Size ranges from macroscale to nanoscale. The protein, individual atom, DNA shows the 10 nanometers and 1 nanometers. Ranges the different particle size. These are the challenges of nanoparticles. The challenges of nanotechnology in fabrication and processing of nanomaterials and nanostructures include
దాన్ని follow the maximum try చేస్తాను సార్ 2 4
how to overcome the huge surface energy, whether the synthesized particles are desired size, uniform size, distribution, morphology, crystallinity, and chemical composition, and how to overcome the agglomeration property, and the biological applications of these synthesized silver nanoparticles. Why I choose silver nanoparticles for my thesis research work? These silver nanoparticles show wide applications in the field of nanomedicine. I have chosen the silver nanoparticles to my thesis work. The These exhibits the applications in nanomedicine, nanoelectronics, biomaterials, energy production, and the silver nanoparticles can be synthesized by several methods. They can be divided into three broad categories: physical synthesis, chemical synthesis, biogenic synthesis. In biogenic synthesis, we use using plant extracts and microorganisms synthesize the green silver nanoparticles. Among them, I have chosen biogenic synthesis due to its less toxicity and eco-friendly nature. These are the biomedical applications of green synthesis silver nanoparticles from literature. These green synthesis silver nanoparticles are abundantly used in photoimaging, cosmetics, and medical applications, biomedical applications, treating the cancer treatment options, and catalytic process, catalysis, and food packaging and food safety processes, and nanosensors detect the biomolecules and environmental factors, and photothermal therapy in some of the cancers, and antimicrobial activity of the microorganisms. Although there are several biomedical applications and regarding green synthesized silver nanoparticles from various sources, there is less reports available on Catharanthus roseus and Azadirachata indica, and no reports available on antibacterial activity and multidrug resistant bacteria of septic wounds collected from humans. Hence, we have chosen to demonstrate the wound healing efficacy in bulbous mice and anti-cancer activity against B16F10 melanoma cell line. Hence, the present investigation has been undertaken with the following objectives. Objective 1, green synthesis and characterization of silver nanoparticles from Catharanthus roseus and Azadirachata indica. And Objective 2, investigating the antibacterial properties of Catharanthus roseus silver nanoparticles and Azadirachata indica silver nanoparticles in multidrug resistant bacteria isolated from septic wounds of humans. And coming to the Objective 3, evaluating the wound healing efficacy of Catharanthus silver nanoparticles and Azadirachata indica silver nanoparticles in vivo using bulbous mice excision wound model. Coming to the fourth objective, assessing the anti-cancer activity of Catharanthus roseus silver nanoparticles and Azadirachata indica silver nanoparticles using B16F10 melanoma cell line. Why green synthesized silver nanoparticles I have chosen? These green synthesized silver nanoparticles are eco-friendly and low cost, showing low toxicity. Green synthesized silver nanoparticles can be used for large-scale synthesis by several simple and reliable methods, and no need to use high pressure, temperature, and chemicals. These green synthesized silver nanoparticles can be synthesized in various shapes such as spherical, rod, and octagonal and hexagonal shapes. Presence of negative charge on their surface make them more reactive. And these AGNPs show strong antimicrobial activity against variety of microorganisms. And these AGNPs exhibits a surface plasmon resonance. These silver nanoparticles exhibits antibacterial, anti-cancer, antioxidant, and wound healing properties. Why Catharanthus roseus and Azadirachata indica I have chosen for my research work? Even these two plants are evergreen, shrub and herbaceous plants, and wide range of medicinal properties, and showing most demanding medicinal plants. Two dimeric alkaloids, vincristine and vinblastine in Catharanthus roseus and nimbin in Azadirachata indica possess anti-cancerous properties, and their demand is much higher in the pharmaceutical industries. Coming to my objective 1, the green synthesis and characterization of silver nanoparticles from Catharanthus roseus and Azadirachata indica. Green synthesis of silver nanoparticles. Biosynthesis of nanoparticles is considered a green technology as it does not involve any harmful chemicals, and the biological synthesis of silver nanoparticles provides a means for improved techniques compared to the traditional methods that call for the use of harmful reducing agents. And the chemical and physical methods for the synthesis are very costly, toxic, and affects the medical applications. Biogenic methods of silver nanoparticles synthesis are eco-friendly and produce nanoparticles with precise shape and size. The use of plants for the fabrication of nanoparticles has drawn attention because of its rapid, economical, eco-friendly protocol provides a single-step technique for the biosynthesis process. These are the characterization methods I have used to analyze the green synthesized silver nanoparticles. UV visible spectroscopy, transmission electron microscopic analysis, X-ray diffraction analysis, scanning electron microscopic analysis, Fourier transform infrared analysis, dynamic light scattering analysis. These are the two plant sources I have choose Catharanthus roseus leaf extract and Azadirachata indica leaf extract. We are interested to study these biosynthesis silver nanoparticles from these plant sources. This Catharanthus roseus is also called as Madagascar periwinkle or Cape periwinkle. This is the protocol I used for synthesis of silver nanoparticles from Catharanthus roseus and Azadirachata indica leaf extracts. 10% of leaf extracts I have used to treat with 1 millimolar silver nitrate. This silver nitrate reduces the phytochemicals present in the leaf extracts of Catharanthus roseus and Azadirachata indica leaf extract through bioreduction mechanism. The dehydrogenation reaction reduces silver ions and formation of the green synthesized silver nanoparticles. This is the colorimetric method. Bioreduction shows the 1 millimolar to 5 millimolar silver nitrate with different concentration ranges concentrations. The leaf extract reduces the undergoes bioreduction mechanism and silver ions color changes from yellow brown to dark brown. This is Catharanthus roseus leaf extract treated with 1 millimolar to 5 millimolar. This is Azadirachata indica leaf extract treated with 1 millimolar to 5 millimolar silver nitrate. This is the UV visible spectroscope used to studying absorption of synthesized silver nanoparticles. I have performed this UV spectrophotometer. The reduction was observed in Catharanthus roseus at 315 to 316 nanometers range. In Catharanthus with 1 millimolar to 5 millimolar. The different color of concentration gradients represents the absorption. This is the Azadirachata indica. The UV visible spectrum. The color peaks of 1 millimolar to 5 millimolar. The reduction was observed at 410 to 440 nanometers in Azadirachata indica. After that, for studying the crystalline nature of the synthesized silver nanoparticles, I have performed X-ray diffraction analysis. X-ray diffraction was carried out to confirm the crystalline nature. The X-ray diffraction pattern showed number of Bragg reflections that may be indexed on the basis of the face-centered cubic structure of silver. A comparison of our XRD spectrum with the standard confirmed with the silver nanoparticles formation. These nanocrystals evidence the peaks at 2 theta values to 27.9 degrees, 32.2 degrees, 34.6 degrees, 38.4 degrees, 44.24 degrees, 57.89 degrees, 64.71 and 77.46 degrees corresponding to 210, 113, 200, 1111, 124. To 240, 226 and 300 respectively for silver. The XRD results clearly show the AGNPs formed by the reduction of silver ions by the Catharanthus roseus and Azadirachata indica extracts are crystalline in nature. The black line represents the Catharanthus roseus silver nanoparticles and the red one represents the Azadirachata indica silver nanoparticles crystalline nature. These are the good agreement with the JCPDS number 840713 and 040783 represents the silver metal. After that, I have investigated the FTIR analysis of green synthesized silver nanoparticles. These silver nanoparticles presence of different phytochemicals in the leaf extracts. Analysis through Fourier transform infrared analysis. The prepared silver nanoparticles from the leaf extract were pelleted with potassium bromide and subjected to FTIR analysis. The principal peaks 3433 centimeters for amino group stretching and provides the stabilization of green synthesized silver nanoparticles, and 2854 for alkyne group and 2924 for CH stretching aromatic ring stretching, and 1632 for CO stretching and 1384 for COC and carboxy and CO bonds. The above evidence proposed that the silver nanoparticles may be capped with these functional groups of alkalides form a layer on the surface of nanoparticles, could act as reducing and stabilizing agents of the nanoparticles. This red one represents the Azadirachata indica silver nanoparticles, and a black one represents the Catharanthus roseus silver nanoparticles, functional groups present in the leaf extracts. After that, we measured the size distribution of green inside silver nanoparticles through dynamic light scattering technique. In this technique, the green Catharanthus roseus silver nanoparticles particle size observed the sharp peak at 110 nanometer, ranges from 80 to 250 nanometers, and in Azadirachata indica, we observed the sharp peak at 60 nm, ranges from 40 to 80 degrees. This size distribution we observe the green synthesize silver both synthesize silver nanoparticles. After that, the surface structure and morphology of the green synthesize silver nanoparticles were studied using field emission scanning electron microscope. In this, the bare silver nanoparticles shape shows spherical shape, and this Catharanthus silver roseus silver nanoparticles shows spherical embedded agglomerated particles. Shows the nanoparticles size ranges from 48 to 16 diameter range. This is the Azadirachata indica silver nanoparticles field emission scanning electron microscopic image. The spherical shaped green inside silver nanoparticles are agglomerated and formed in the sheaths. After that, the elements present in the green inside silver nanoparticles perform the same EDAX. Using EDAX, quickly generate the information about the chemical composition of a sample, including what elements are present as well as distribution and concentration. This EDX detector and X-rays can also be used as a signal to produce the chemical information. The same images showed cubical and relatively uniform shape of nanoparticle formation with diameter range 48 to 67 nm. And the vertical axis displays number of X-ray counts, while horizontal axis displays the energy in kiloelectric volts. These are the same EDAX of the Catharanthus roseus silver nanoparticles. This sharp peak represents the presence of element silver. This element carbon, oxygen, chlorine, and silver is present. The weight percentage of silver is more compared to the other metals. 51.31, the atomic percent 13.4, and net intensity is 116.16. This is the same EDAX of Azadirachata indica silver nanoparticles. The sharp peak represents the presence of silver. This is silver net intensity is 167.46, and atomic percentage 19.94, and weight percentage 64.67. After that, AGNP's morphology, size, and shape of the synthesized silver nanoparticles were analyzed using transmission electron microscope. The operating voltage is 200 kiloelectric volts. The AGNPs were transferred into a new vial using spatula. This suspension was made by adding 95% alcohol, followed by 15 minutes ultrasonication in an ultrasonic water bath. A drop of particle suspension was loaded onto carbon-coated copper grid and drying under lamp allowed to evaporate before weighing. These AGNPs are harvested from 10%, showing the different particle sizes ranging from 10 to 200 nanometers. The average diameter is 13 nm. This is the different magnifications: 20 nm, 50 nm, 100 nm, and 200 nm. The particles average size is 30 nanometers in Catharanthus roseus silver nanoparticles. These transmission electron microscopic images clearly shows the diameter of Catharanthus roseus silver nanoparticles, and this is the transmission electron microscopic images. Azadirachata indica particle size is 13 nanometer with a spherical shape, which clearly shows. This is my objective 1 summary. We synthesized successfully silver nanoparticles from Catharanthus roseus and Azadirachata indica leaf extracts and illustrated bioreduction mechanism of silver nanoparticles. The green synthesized silver nanoparticles are well characterized using UV visible spectroscopy, X-ray diffraction analysis, Fourier transform infrared analysis, dynamic light scattering technique, field emission scanning electron microscope, and EDAX and transmission electron microscope. The optical property of green synthesized silver nanoparticles showed absorbance at 315 to 316 nanometers in Catharanthus roseus and at 410 to 440 nanometers in Azadirachata indica. The morphology of green synthesized silver nanoparticles are spherical, crystalline, cubic structure having average size of 13 nanometers respectively. We are synthesized and characterized the silver nanoparticles from Catharanthus roseus and Azadirachata indica leaf extracts through green root, and their optical and functional properties derived us to evaluate the antibacterial efficacy on multi-drug resistant organisms isolated from septic wounds of humans due to their small size and morphology. Coming to my objective 2, investigating the antibacterial properties of Catharanthus roseus silver nanoparticles and Azadirachata indica silver nanoparticles in multi-drug resistant bacteria isolated from septic wounds of humans. These are the list of techniques I have used in this objective: antibiotic susceptibility test, turbidity test, cell damage of multi-drug resistant bacteria through transmission electron microscopic analysis, and antioxidant assess DPPH and ABTS. Multi-drug resistant organisms shows the multi-drug resistance is a condition enabling a disease-causing organism to resist distinct drugs, chemicals of a wide variety of structure and function targeted at eradicating the organism. The limited therapeutic options are further compromised by fact that wound bacteria often coexist with a biofilm community which enhances the bacterial tolerance to antibiotics. Three most common multi-drug resistant organisms are methicillin resistant Staphylococcus aureus, vancomycin resistant Enterococci, extended spectrum beta lactamase producing Enterobacteriaceae. Tropical antiseptics may be important consideration for minimizing the opportunity for wound infections involving multi-drug resistant organisms. We are isolated the multi-drug resistant bacteria samples Escherichia coli, Klebsiella pneumoniae, Staphylococcus aureus and Pseudomonas aeruginosa from septic wound patients in Rajiv Institute of Medical Sciences, Kadpa. We further investigated the efficacy of green synthesized silver nanoparticles on MDR bacteria due to their small size and optical properties. These are the multi-drug resistant bacteria antibiotic susceptibility test. Results: the 4 organisms are tested with Catharanthus roseus silver nanoparticles and Azadirachata indica silver nanoparticles. These are the positive control group: tetracycline, ampicillin, and erythromycin I have used. These CAGNPs used at low concentration to high concentration 10, 30, 60, 90 and 120 microliters. I have used the zone of inhibition is increases from lower concentrations to high concentration in multi-drug resistant bacteria E. coli, Klebsiella pneumoniae, Staphylococcus and Pseudomonas aeruginosa, and Azadirachata indica silver nanoparticles also shows the antibiotic susceptibility in the 4 organisms. This is the graphical representation of antibiotic susceptibility test. The lower concentration to higher concentration, the zone of inhibition was increased and the bacterial growth was inhibited. The maximum bacteriolytic activity of green synthesized CAGNP shown at 19 and 16 mm zone of inhibition at the highest concentration. This is the tabulated data of antibiotic susceptibility. At highest concentration, the zone of inhibition 19 mm and in Azadirachata indica 16 and 14 mm was observed. After that, further I have investigated the quantitative method to assess the bacterial growth inhibition of MDR bacteria treated with green synthesized silver nanoparticles. This is the protocol I have used. So here the control groups and these tested concentrations I have used on E. coli, Klebsiella pneumoniae, Staphylococcus aureus and Pseudomonas aeruginosa. The concentration was increased, the turbidity growth was inhibited in the organisms treated with Catharanthus roseus silver nanoparticles. And there is no significant inhibitory action was observed after increasing the concentration. This microorganisms shows the dose exclusion mechanism, and their mechanism is still not illustrated. And this is the turbidity method for treated with Azadirachata indica silver nanoparticles in multi-drug resistant organisms. This is the E. coli and Klebsiella pneumoniae, Staphylococcus and Pseudomonas aeruginosa. The control groups, and this is the concentrations 10 to 15 microliter concentrations I have used. The growth inhibition was observed in all organisms. After that, I was investigated the cellular damage of multi-drug resistant bacteria through transmission electron microscopic analysis. This is the protocol I have used, and these images are I got from 100 nanometers and 200 nanometers using lower and higher concentrations of green synthesized silver nanoparticles treated with 4 multi-drug resistant microorganisms. This E. coli at 100 and 200 nanometers shows the cellular damage clearly. In Azadirachata indica silver nanoparticles also shows the bacterial cellular damage. In Catharanthus roseus, in Azadirachata indica, both nanoparticles shows effective cellular damage in the 4 multi-drug resistant microorganisms. After that, I have investigated the antioxidant activity of green synthesized silver nanoparticles. I have used this DPPH antioxidant activity. This is the protocol I have used. This purple color solution of turns into yellow color solution turns into purple color solution at 517 nm. This is the graphical representation of antioxidant activity. The IC50 values got from Catharanthus roseus silver nanoparticles 36 microliters and 35 microliters, and quercetin is standard for 26 microliters. After that, ABTS antioxidant activity, the Miller and Rice Evans technique I have used. This is the general protocol, and this is the principle used for assessing the antioxidant activity. This light blue color solution turns into dark green solution. This graphical representation represents the IC50 values of CAGNPs 45 and AAGNPs 43 and quercetin 26 micrograms per ml. Coming to my objective 2, green synthesized silver nanoparticles showed effective antibacterial efficacy and multi-drug resistant bacteria isolated from septic wounds of humans. And these green synthesized silver nanoparticles effectively damage cellular morphology on MDR bacteria. And these green synthesized silver nanoparticles showed greater antioxidant property. After evaluating the antibacterial activity in MDR bacteria, we further investigated the wound healing efficacy of green synthesized silver nanoparticles in vivo using bulb C mice excision wound model. Coming to my objective 3, evaluating the wound healing efficacy of Catharanthus roseus silver nanoparticles and Azadirachata indica silver nanoparticles in vivo using bulb C mice excision wound model. These are the list of techniques I have used in this objective excision wound model: histopathology examination, hematoxylin and eosin staining, mass and trichome staining, and biochemical assays, hydroxyproline, DNA and protein estimation. Wound healing is a dynamic process and cascade of regulated coordinated events between biological and immunological systems with numerous types of cells. These are the wound healing phases: inflammation, proliferation and remodeling. These phases have inhibit or reduces inflammation and oxidation at lower dose and promotes the fibroblast migration, granulation and tissue formation and reepithelialization, collagen deposition. And in remodeling phase promotes the wound contraction and scar tissue formation. These are the time being from wound healing phases, from hemostasis to remodeling phase. This is the experimental design of wound healing in biopsy mice, biopsy punch model. 5 tested groups: group 1, group 2, group 3, 4, 5. Group 1 is control group, and group 2 is positive control betadine group, and group 3 is vehicle control vaseline group, and group 4 Catharanthus roseus silver nanoparticles group. Group 5 is Azadirachata indica silver nanoparticles. I have used 3 mice for each group in experiment, and number of experiments repeated 3 times. So this control group no treatment, and positive control betadine, vehicle control vaseline group I have used, and CAGNPs 1 mg per 1 gram vaseline, 1% weight by weight formulation I have prepared, and AAGNPs 1 mg per 1 gram vaseline with 1% weight by weight. The treated wounds with various positive controls and nanoparticle formulations in alternative days. These wound constrictions were measured with the help of vernier caliper. The wound was created with 5 mm biopsy punch on the dorsal side of mice by sandwich folding of skin. These two wound sites were mice on the dorsal side. This is the protocol I have used for excision wound healing model, biopsy punch model. And the formula I have used percent wound closure, area of wound, original wound by area of actual wound by area of original wound into 100. This is the schematic representation of creating the excision wounds in mice with biopsy punch 5 mm and the sandwich folded of skin. 2 excision wounds in each mice I have created, and this is the anesthesia dose I have used. These are the images captured at alternative treatment days 0, 1, 3, 5, 7, 9 and 11. These are the treatment groups and positive control groups. The images were captured. The wound constriction was observed at 11th day before the sacrifice. In control, positive control and vesical control group, the wound constriction was delayed, and in Catharanthus, roseus and Azadirachata indica silver nanoparticles, the enhanced wound healing efficacy was observed at the 11th day. This is the graphical representation of wound healing efficacy in 5 treatment groups. The Catharanthus roseus silver nanoparticles shows high wound healing efficacy at 11th day, 9th day, and all days progression, day 1 to day 11. And this is the tabulated data of percent wound closure in biopsy mice. This control group shows the 74% of wound healing efficacy, and the betadine positive control group shows 79%, and this vaseline group shows 76%, and this 1% Catharanthus roseus silver nanoparticles formulation group shows 94% wound healing efficacy, and 1% Azadirachata indica silver nanoparticles group shows 87% wound healing efficacy. Among all treatment groups, Catharanthus roseus silver nanoparticles group shows highest wound healing efficacy in biopsy mice. Further, we want to observe the architecture of wound area. We have performed Antibacterial and eosin staining and Mason's trichome staining. This is the protocol I have used for Antibacterial and eosin staining. These are the cross sections of Antibacterial and eosin staining of 5 treatment groups. Here in the control group, the granulation tissue and adnexal restoration was observed in positive control vehicle control group. In CAGNPs and AAGNPs groups, more moderate to complete restoration of epithelium was observed compared to positive control and vehicle control group. Moderate to high granulation tissue and some of the infiltrations also observed in the Catharanthus roseus and Azadirachata indica groups, and adnexal restoration of dermis was observed completely. In Azadirachata indica group also, the moderate restoration of squamous cell epithelium with focal areas of ulcerations also observed, and proliferation of granulation tissue and inflammatory cell infiltrations also observed, and adnexal restoration of dermis also observed. After that, for estimating the collagen content in wound tissues, we performed the Mason trichome staining. These are the cross sections of wound healing tissues. In control group, the collagen fibers and mild collagen fibers also observed. In positive control and vehicle control, mild collagen fibers and coarse collagen fibers also observed. In CAGNPs and AAGNP shows the fine collagen deposition in wound skin with moderate proliferation of squamous cell epithelium and fibrous tissue, and adnexal restoration also observed. This positive control group shows mild collagen deposition, and in the control and vehicle control samples, collagen was less deposited at the wound area. For estimating the hydroxyproline content in the wound tissues, we performed the hydroxyproline through biochemical method. This is the protocol I have used to estimate the hydroxyproline content in the wound healing tissues. These are the values of 5 treatment groups of hydroxyproline content. In control group 0.321, in positive control group 0.451, in vehicle control group 0.317, in CAGNPs group 5.31, 0.531, in AAGNPs group 0.443 micrograms mg per tissue, micrograms per mg tissue are estimated. The Catharanthus roseus silver nanoparticles shows high hydroxyproline content in the wound healing tissues. After that, I have estimated the DNA and protein content. This is the DNA estimation through diphenyl method. This is the protocol I have used. These are the results of estimation of DNA content in the wound healing tissues. Control 5 treatment groups shows the 36.6 in control group and 40.26 in the positive control group and 29.9 in vehicle control group, and Catharanthus roseus shows 44.5 micrograms per 100 mg tissue, and AHNP shows 43.6 micrograms per 100 mg mean DNA concentration was estimated. Here also the Catharanthus roseus silver nanoparticles treated group shows the high DNA content in the wound tissues. After that, I estimated the protein estimation through Lowry method. This is the protocol. This is the wound healing protein estimation through wound skin. These are the 5 treatment groups. Shows the control group shows 0.373 and positive control 0.474 and vehicle control 0.329, and Catharanthus group shows 0.504 and AHNP shows 0.51 mg per 100 mg tissues. This is the mean total protein we are estimated. Coming to my objective 3 summary, the green sensor silver nanoparticles showed enhanced wound healing activity in bulbsy mice, and these green sensor silver nanoparticles treated tissues showed enhanced hydroxyproline in wound tissues for estimating the collagen content using biochemical method, and these green sensor silver nanoparticles showed high DNA and protein content in wound healing tissues. These green sensor silver nanoparticles may use as good wound healing agents for diabetic wound patients and burn wound patients. After evaluating the wound healing activity of green sensor silver nanoparticles, we further investigated anti-cancer activity of green sensor silver nanoparticles on B16F10 melanoma cell line. This is my 4th objective, assessing the anti-cancer activity of CHNPs and AHNPs using B16F10 melanoma cell line. This is the protocol I have used to assess the cytotoxicity of normal cell line and cancerous cell line MTTSA. This is the general protocol. Before going to check the anti-cancer activity, we investigated the normal cell line cytotoxicity in embryo mouse embryonic fibroblast cells. Our compounds checked the cytotoxicity. The Catharanthus roseus and Azadirachata silver nanoparticles, lower concentration to higher concentrations were treated with mouse embryonic fibroblast cell in NIH3T3 at lower concentration 6.25 micrograms to at higher concentration 100 micrograms per ml. The cytotoxicity was not observed at lower concentrations and shows less cytotoxicity at higher concentrations. This is the graphical representation of cytotoxicity observed in the embryonic fibroblast cell line. The IC50 values of CHNPC is 72 micrograms and AHNPC is 93 micrograms, calculated ED50 plus software. After checking the cytotoxicity in normal cell line, we went ahead on the B16F10 melanoma cell line. This is the schematic. This image represents the skin cancer progression from squamous cell carcinoma to melanoma cell in skin cancer. This is the skin cancer cell line to test the cytotoxicity of green sensor silver nanoparticles from lower concentration to higher concentration. This green sensor silver nanoparticles shows cytotoxicity at lower concentrations and increasing this cytotoxicity activity at a higher concentration 100 micrograms per ml. This is the graphical representation of cytotoxicity and in melanoma cells of green sensor treated with green sensor silver nanoparticles. The IC50 value of CAGNPC is 59 micrograms per ml and for AAGNP 63 micrograms per ml in melanoma cells, calculated through ED50 value. After checking the green sensor silver nanoparticle cytotoxicity and cell proliferation and in normal and melanoma cells, we went ahead on the investigating the cell migration of normal and melanoma cells treated with green synthesized silver nanoparticles using scratch assay method. This is the protocol I used for cell migration analysis of green synthesized silver nanoparticles. This is the scratch assay protocol. The cell migration analysis in mouse embryonic fibroblasts, 0 at different time points, 0 hours, 48 hours, and 96 hours. This is the control group, and this is the CA-GNPs and AA-GNPs groups. At 0 hours, the cell migration was not observed. At 96 hours, the cell migration was observed. These green synthesized silver nanoparticles enhances the cell migration activity in normal cell line of mouse embryonic fibroblast cells. These are the wound area measured. The cell migration analysis in cell migration in mouse embryonic fibroblast at 0 hours, 48 hours, and 96 hours. This is the Catharanthus roseus and Azadirachata silver nanoparticles migration. After that, we analyze the cell migration in melanoma cell line. These are the control group, and Catharanthus roseus and Azadirachata silver nanoparticles treated melanoma cells source in cell migration inhibition at 24 hours and 48 hours. This is the wound area measured cell migration of green synthesized silver nanoparticles in melanoma cell lines at 0 hours, 24 hours, and 48 hours. In addition, based on previous data confirmed the inhibition of migration in melanoma cells, we stained the cells with fluorescein diestate, which clearly showed the inhibition at 96 hours. This is the control group. This is the CA-GNPs and AA-GNPs group. That at 96 hours time point, the cell migration inhibition was clearly shows, and this fluorescein diestate stained cells shows the clear fluorescent microscopic images. After cell migration analysis, I investigated the DNA damage through COMET assay with single cell gel electrophoresis method. This is the protocol I have used. In DNA damage COMET assay analysis, the control group, positive control doxorubicin groups, and Catharanthus roseus silver nanoparticles groups, and AAGN groups shows the tail length and COMET length treated with treated with both green synthesized silver nanoparticles with IC50 values concentration. These are the graphical representation of comet soaring of embryonic fibroblast cells. The comet length and tail length represents in the pixel. The Catharanthus roseus and green Azadirachata silver nanoparticles, both green synthesized silver nanoparticles, shows less DNA damage compared to the positive control doxorubicin group. Coming to my fourth objective, summary, green synthesized silver nanoparticles shows reduced cytotoxicity in embryonic fibroblasts cells, and green synthesized silver nanoparticles showed effective anti-cancer activity in melanoma cells, and green synthesized silver nanoparticles showed less DNA damage in embryonic fibroblast cells, and green synthesized silver nanoparticles may use as good anti-cancer agents for melanoma cancer. This is the summary of my work. Administration of green synthesized silver nanoparticles are non-toxic to mice, and these nanoparticles are good wound healing agents. And these green synthesized silver nanoparticle treated wounds inhibited multi-drug resistant bacterial growth isolated from septic wounds and acts as good antibacterial agents. And green synthesized silver nanoparticles showed enhanced anti-cancer activity in melanoma cell line and showed reduced cytotoxicity in embryonic fibroblast cells. And green synthesized silver nanoparticles showed tremendous skin regeneration in murine model Balbsi mice. And green synthesized silver nanoparticles treated wounds showed the coarse and fine collagen deposition in wounded skin with moderate proliferation of squamous cell epithelium and fibrous tissue and adnexal restoration, moderate to high granulation tissue and mild inflammatory cell infiltration observed in wound tissue samples treated with green synthesized silver nanoparticles. Coming to concluded my work, green synthesized silver nanoparticles showed enhanced wound healing efficacy in vivo Balbsi excision model, and green synthesized silver nanoparticles showed antibacterial efficacy against MDR bacteria and antioxidant activity. Green synthesis silver nanoparticles may be potential therapeutic target for chronic burn, surgical wounds, and diabetic foot ulcers. This is my future outlook to evaluate the wound healing efficacy of green synthesis silver nanoparticles in induced diabetic wound healing model. And we can conjugate these Catharanthus, roseus, and Azadirachata silver nanoparticles with fluorescent tag, help in imaging technology to understand the in vivo mechanism in several diseases, including cancer and wound healing. This is a schematic representative of green synthesis silver nanoparticles published in my antibiotic journal with impact factor 4.639. These are the list of publications. My thesis work published in antibiotic journal with impact factor 4.639. This is the role of statin in colorectal cancer development. Few of my similar kind of work conducted in our laboratory, and I was published this review work and as first author. This is the other publications. Manuscripts are prepared and under communication. Stop channel. Answers to the queries raised by the adjudicators. Why is the rationale behind fixing the dose of 1 mg per gram Vaseline? Any dose dependent wound healing experiments was conducted. What is the effect of higher or lower concentration of nanoparticles on wound healing? The rationale behind fixing the dose of 1 mg per gram Vaseline is based on the literature. Recently, Nethi et al. Used 1 mg per gram Vaseline with synthesis silver nitroprusside complex nanoparticles. This is the reference number Nethi et al. 2018. The significant effect of higher or lower concentration of nanoparticles on wound healing is well established in the literature. Hence, we have chosen 1 mg nanoparticle per gram Vaseline in our studies to reduce the cost and number of animals in dose-dependent wound healing experiments. The nanotechnology and green synthesis is an upcoming research field. How far this work has commercial viability in preparing the gel and transfer the technology to pharma industry is my second question. Yes, we agree with the reviewer and that nanotechnology and green synthesis is an upcoming research field. Our work would definitely have commercial value after standardizing in vitro human wounded skin cultures and then prepare the gel to transfer the technology into pharma industry. It requires FDA approval to sell a new prescription drug and must complete a 5-step process: discovery, concept, preclinical research, clinical research, FDA review, and FDA post-market safety monitoring. Results from my thesis contributes the discovery, concept, preclinical research, and green synthesis silver nanoparticles. So future clinical studies and FDA approvals are required to transfer the technology to pharma industry. Question 3. Investigators have to use tetracycline, ampicillin, and erythromycin as positive controls in evaluating antibacterial activities of CA-GNPs and AA-GNPs. Why did they not consider using vancomycin and phosphomycin, which are used in treating MDR bacterial infections? One control, the form of silver nitrate, could have to also be included for more valid inferences. Tetracycline, ampicillin, and erythromycin are broad spectrum agents exhibiting antibacterial activity against a wide variety of gram-positive and gram-negative bacteria. Previous work from our laboratory, we have used tetracycline, ampicillin, and erythromycin as positive controls. Hence, in the current study, we have used the same. We agree with the examiner that vancomycin and phosphomycin are used in treating MDR bacterial infections, and we will include them in our future studies. We agree with the examiner that silver nitrate alone control could have been included for more valid inferences. Specifically, silver nitrate has shown different effects against bacteria as high concentrations and killing bacteria by different mechanisms. At higher concentrations, it kills bacteria, whereas at lower concentrations, it induces them to synthesize silver nanoparticles. Kawashin et al. Reported in 2015, and we will use these non-histotoxic concentrations of 0.5% in our future experiment. Coming to the fourth question, the rationale behind considering female bulbsy mice to be mentioned. In the literature, female mice are used in many wound healing experiments. In our experience also, male might fight more compared to female in the animal cage. If we use male bulbsy mice for making wounds, they may fight each other in the cage and wound may get bigger. To avoid this problem, we have used female bulbsy mice for our experiments. Question 5 is how many mice used in each group? We have used 3 female bulbsy mice in each group and 6 wounds were created to get statistical significance of in vivo wound healing experiment. Why is PBS considered as negative control is my 6th question. And PBS is used as negative control in the experiment for no treatment group. And because PBS itself doesn't have any effect on wound healing. And why was the doxorubicin used only in DNA damage analysis and not in other experiments on cytotoxicity and cell migration analysis is my 7th question. Doxorubicin is well-known chemotherapeutic agent and its cytotoxicity and cell migration efficacies were analyzed in previous studies in 2019. And doxorubicin promotes the migration invasion of breast cancer cells through the upregulation of RHO-A and MLC pathway. Hence, we use doxorubicin only in DNA damage analysis. Due to doxorubicin-induced free radicals may cause oxidative stress resulting in DNA damage and cell death. My sincere acknowledgement to my research supervisor, Dr. L. Dakshayani Madam, Associate Professor, Department of Genetics and Genomics, Dr. C. Madhur Reddy Sir, Associate Professor, Department of Biotechnology and Bioinformatics, Dean and Faculty of Life Sciences, Dr. K. Krishna Reddy Sir, and Principal of Vayogavemna University and Chairman, BOS, Department of Genetics and Genomics, Dr. N. Lakshman Reddy and Dr. V. Naukateshwar Rao from Department of Material Science and Nanotechnology, Dr. P. Roja Rani Madam, Department of Microbiology, and all the faculty members in the Department of Genetics and Genomics, Dr. B. Ramesh Sir, Dr. A. Munikumar Madam, Dr. P. Ushman Basa Sir, and non-teaching staff of the department. My lab mates, Dr. G. Surendra and Dr. M. Saira and M. Saira Banu and Agri Science Park family members, my friends, and this research work is supported and funded by DST SERB project sanctioned by Dr. L. Dakshayani Madam. Thank you.
Now it is open for the questions.
No, I can share. Just Anna, ఇది స్టాప్ షేరింగ్ ఇది వీడియో కనబడాలి నా ప్రెజెంటేషన్
ఈ ప్రెజెంటేషన్
ఒక ప్రెజెంటేషన్ మినిమైజ్ చేసి
Questions or queries from the students, scholars, faculty.
Sir?
Catharanthus roseus plant is itself cytotox.
Yes.
Yeah, new plant is also cytotox. Because of the second metabolites from it, as they are acting as captive ligands, they will cause cytotoxicity when they are in silver metals. So compared with the pure extracts, the cytotoxicity.
The extracts only particles, sir. No, sir. Only silver nanoparticles we compared, sir. Extracts we are not using, sir.
You need to form that. One antibacterial.
Okay, sir.
And with one of the Azadirachata, silver nitrate also you need to check as a because
Okay, sir. Sure.
as because the better kitchen with silver nitrate.
Sure.
Silver means in that definitely the antimicrobial. So the green synthesis, whether it is enhanced or reduced, is the
చెప్పండి
So, how you seen any incorporation? It's
స్వామి నేను వచ్చింది ఎంతవరకు రాలను కూర్చోద్దాం మనం నువ్వు అరగంట కూర్చొని పో ఇక్కడ మన దాక్షాయని PhD
Yes,
లాస్ట్
sir. As the clear boundaries for the particles they are combined.
Some
You said
agglomeration we have seen.
particles.
Agglomeration we have observed, sir.
Until.
Then kinds
So is it in high amounts?
low amounts.
In IR, we find any functional groups? Yeah, we recorded.
Yeah, recorded, sir. Functional groups, FKIR, we did.
Yeah, have we find any functional groups there?
Yes, sir.
Yeah.
Functional groups 3433. MNNH amino groups, functional groups, and CO, NH, carboxylic and CO.
They recorded up to 500.
No,
To say that the second metabolites act as capping agents, they reduce the some of the functional groups at the same time metal and oxygen bonds in between 400 to 500, 500 to 600 like that. The other node I learned is through optical activity, mentioned something optical. So, as you use only, you prepared only silver nanoparticles, how come so much variation in the optical activity mediated by Catharanthus, roseus, and the Azadirachata? Usually, optical activity means visible spectroscopy, no?
yes.
And in the visible spectroscopy,
రాముడు క్వశ్చన్ 4వ క్వశ్చన్
silver metal have characteristic absorption at a certain range. So for one instrument you mentioned around the 300 or like that, the other one at 400, more than 400. I've seen in the on the side. I've seen that.
Yes.
Such a wide range.
315 to 61.
You mentioned that.
10 to 10. Different concentrations of 1 millimolar.
It is so broad.
Five different concentrations we use చేసినాం sir. One
Concentration is doesn't matter here. Characteristic thing we have cast to it. A little variation may cause by the second derivative, right? Not such variation.
It's not visa.
multitude resistant organisms isolated.
ఇవన్నీ కూడా చూడబ్బా అవ్వ కావాలా పువ్వ కావాలా అన్నీ కావాలా నీకు మనకు వచ్చే సమస్య మొదటిది ఏమిటంటే ఎంబార్కేషన్ డిసెంబార్కేషన్ పక్కా పడతాయి. ఇంటర్నేషనల్ స్టడీకి నువ్వు డేటా కలెక్షన్కి నువ్వు సర్వేకి అడిగిపోనక్కర్లా. కంపెనీకి మనకు లెటర్ రాసి సార్ యాజ్ ఐఎమ్ వర్కింగ్ హియర్ అండ్ ప్లీజ్ సెండ్ ది డేటా అని అడుగుతారు. నానా ఇప్పుడు పోయే దానికోసం ఎల్బీలు సృష్టించకండి, లేని సృష్టిస్తే ఏమవుతుంది అంటే ఇప్పుడు అమ్మాయి ఆనెస్ట్లీ స్పీకింగ్
Sir.
Yeah. So you have done well, you have done good piece of work.
Thank you, sir.
Yeah. So what you are doing at present?
Sir.
At present, what you are doing?
Searching for postdocs.
Huh?
Searching for postdocs.
Searching for postdoc. Now I think I have to declare
Yes, sir. Yes, sir.
yeah. Any other question for the students or faculty sitting over there?
Yes, sir.
Yes, sir, there were some few questions were there.
Okay, so everything is
Any more questions? Sir, no more questions, sir.
okay. How about the Mr. Ekta? He's online.
Krishna Reddy sir is talking. sir.
I think you are first student, right?
Second students.
Second student. Okay. If there are no questions, I conclude this viva mochi and congratulate Miss Nanotechnology for doing good piece of work. And I congratulate and declare that she can be given an award on the thesis entitled Synthesis and Characterization of Silver nanoparticles from Catharanthus, roseus, and Azadirachata, evaluating their antibacterial, anti-cancer, and wound healing properties. So I declare that the virus is went on well and she can be awarded.
Hello, I am audible.
Genetics and genomics.
Thank you so much.
Okay. Now I have one question. That why you have estimated antioxidants?
Sir,
Why you have estimated antioxidants?
for scavenging activity.
Yeah, what's the activity? Scavenging activity for what? The reverse is antibacterial. Reverse is antibacterial. What is the role of antioxidants in wound healing? What is the role of antioxidants in wound healing?
Yes. Yes, sir. It is there in wound healing. Yes. In wound healing, antioxidants role is there.
All the best.
Thank you, sir.
Congratulations to guide also.
Thank you, sir.
That's it.
Thank you, sir. Thank you for your time and for conducting this exam. In spite of your busy schedule. Yes, sir. Thank you. And now I would like to ask Krishna Reddy, sir, to conclude the session. Krishna Reddy, sir.
Thank you. Thank you, Dr. Dakshayani. At this outset, I am very overwhelmed to see the research activity of Miss Vajravati under the supervision of Dr. L. Dakshayani. She made the very good presentation, and her research work is worth for getting a PhD thesis. I have no hesitation to say that she is today onwards declared as the Doctor of Philosophy in Genetics and Genomics after completing the Yogi Vemana University formalities. So, and one thing, and I want to say to few words to Dr. T. Anand that in Yogi Vemana University we have 33 academic programs and 29 departments. So among them, this genetics and genomics is one of the vibrant department in terms of academics and research. All the faculty members are doing extremely good research. It is on par with the a global activity. Though our university has less facilities in town, and also it is away from the town, and some of the logistics and other equipment facilities are less. Nevertheless, our colleagues in the genetics and genomics are doing very well, and I am sure that I have only one question to Vajravati. What is your dream goal? అమ్మా వజ్రావతి,
Yes,
మీ
sir.
జీవితాశయం ఏమిటి?
Becoming a scientist.
You want to become a scientist? Very good, very nice. With the blessings of Drashayani, and definitely you will be one of the young scientists in India or elsewhere on the globe. And I sincerely congratulate Dr. Dakshayani and Vajravati for choosing a novel topic for getting PhD to Vajravati.
Thank you, sir.
Thank you.
Thank you
Please,
so much, sir.
I hand over the mic to. Pardon? Say again.
Thank you so much, sir.
Please, Amma. Okay. I will hand over the mic to Dr. L. Dakshayani.
Sir, thank you, sir. I would like to thank Professor Krishna Reddy, sir, Dean, School of Life Sciences, and Dr. Anand, external expert member from Mysore, and all the faculty members who came here physically as well as virtually, and research scholars, and my dear students. Thank you, one and all. Sir, Anand, sir, thank you, sir. Okay. Okay, thank you, sir. Thank you.